And although I did not win that year, it was a blessing. No, that's all right. It was a blessing because I got to spend an hour in January of 2019 with Andrew Yang. 5 minutes in, I knew that I had made a new friend. A 44-year-old, first-generation American, a father of two who really likes math. Holy crap, that was me. And it turns out that after an hour, I realized I was sitting next to somebody who could be, should be, and will be the President of the United States of this country. And here's the thing. We walked down the street after, bumped into a friend of mine right down here in Manchester, and that person said, "Hey, Steve, who's your friend?" And I said, "My friend, that's Andrew Yang. He's running for president." And the guy said, "No, he's not." That was 13 months ago. And how far we have traveled in the next 13 months. Now we walk down the street, bump into a friend, and they say, "Hey, Andrew, who is your friend?" And in the world of politics, that counts as progress. Somebody that the Washington Post, just a number of months ago, wrote a story about and said, "Random man runs for president." That's what you call starting from zero. Has been polling as high as fourth place by himself in national polls because it turns out that when the people of this state and of this country find out what innovative and young and diverse and damn funny and authentic leadership can look like, what the next generation of the Democratic Party, the next generation of America can look like, they get excited too. Are you excited about that with Andrew Yang? I want to take a second before Andrew comes out, and I want to thank a few people. First, I'm going to use the pulpit to thank my family, my wife Sandy, my daughters Maggie and Abby. Very sweet. But hold on, we got to be quick because it takes a toll on families when people run. I also want to give a shout out to Andrew's family, Evelyn, their two sons, amazing family. And I want to thank the team here in New Hampshire, without which the ascent of Andrew Yang could not have been possible. Our state director, Christina Snell. Other senior leadership, including Michael Anthony and Josephine Ahn. Awesome leadership we had around the state. Matt Bedinger, Walter Bird, Justin Deverts. Awesome team. So privileged to work with you in this New Hampshire primary campaign. And I will tell you, we could not have done anything without the dozens of amazing field staff around the state, most of whom are here tonight. Raise your hand if you were part of this campaign. Give them a round of applause. You have my eternal gratitude, and I know you have Andrew's as well. In the couple of minutes that we got left, here is the challenge that we face as the campaign for the nomination goes beyond New Hampshire. In the Democratic Party right now, there are a lot of people that think that you have to choose. You can choose one of two things, but unfortunately in 2020, they say you cannot have both. You can choose a leader who understands the inequality that is ravaging this economy, the inequality that led to the election of Donald Trump. And we could get a leader that could rewrite the rules of the 21st century to work for all Americans. Would you like that leader? Yeah. And there are others that say you can't have that, but you can have the best person to beat Donald Trump because who wants to beat Donald Trump? And can bring together this country, but you can't have both. Ladies and gentlemen, you can, and in this campaign we have shown you can. That person is Andrew Yang. Now, that's right. Andrew Yang. Save your vocal cords, baby. Because in a matter of seconds, I've been privileged to introduce him so many times, sometimes for 2 minutes, sometimes for 40 minutes. You're very lucky. Tonight is not 40 minutes. Tonight it is all done. Because your friend, my friend, New Hampshire's friend, he's walking in that door, Andrew Yang.
thank you so much for being here. And I want to give a special thank you to my rock, my wife, Evelyn, who's been with us every step of the way. I love you and appreciate you so much, baby. Thank you so much. New Hampshire and everyone who supported this campaign, thank you for everything you've done to make this campaign possible over these past months. You all have uplifted me and inspired me and Evelyn in this campaign at every turn. Your passion and energy, your donations, and hundreds of thousands of hours calling, volunteering, your enthusiasm, dedication, and commitment. We've accomplished so much together. We have brought a message of humanity first and a vision of an economy and society that works for us and our families to millions of our fellow Americans. We went from a mailing list that started with just my Gmail contact list to receiving donations from over 400,000 people around the country and millions more who've supported this campaign. One of the things I'm most proud of, we gave $1,000 a month to 13 families around the country, including Jody Fassey right here in New Hampshire. We highlighted the real problems in our communities as our economy is being transformed before our eyes by technology and automation. And Americans know now that when you go to a factory in Michigan, you do not find wall-to-wall immigrants doing work. You find wall-to-wall robot arms and machines doing the work that people used to do. We stood on the debate stage and shifted our national conversation to include the fourth industrial revolution, a topic no one wanted to touch until we made it happen here with this campaign. Our signature proposal, universal basic income, has become part of the mainstream conversation. We increased the popular support for universal basic income to 66% of Democrats and 72% among voters 18 to 34. Without a doubt, we accelerated the eradication of poverty in our society by years, even generations. And that is thanks to all of you who are here tonight. Though thousands of voters came out for our campaign tonight, tonight is not the outcome we fought so hard to achieve. It is bitterly disappointing for many of us, but it shouldn't be. Every single day I've been campaigning, I've had supporters say to me, "Your campaign helped me out of a depression. Thank you." Working on this campaign has made me a better person. I met my significant other because of you. Your campaign brought my family together. Your campaign got me excited about politics for the first time. These are all things that people have said to me in the past days, and they are the reasons why I am so incredibly proud of this campaign and what we've accomplished together. We have touched and improved millions of lives and moved this country we love so much in the right direction. And while there is great work left to be done, you know I am the math guy, and it is clear tonight from the numbers that we are not going to win this race. I am not someone who wants to accept donations and support in a race that we will not win. And so tonight I am announcing I am suspending my campaign for president. Thank you. I love you too. Thank you, New Hampshire. Thank you so much. Thank you so much, New Hampshire. I love you too. This is not an easy decision or something I made lightly with the team. Endings are hard, and I've always had the intention to stay in this race until the very end. But I have been persuaded that the message of this campaign will not be strengthened by my staying in this race any longer. Endings are hard, New Hampshire, but this is not an ending. This is a beginning. This is just the starting line. This campaign has awakened something fundamental in this country and ourselves. This movement has outlasted over a dozen senators, governors, and members of Congress to become the most exciting force in this entire race. The Yang Gang has fundamentally shifted the direction of this country and transformed our politics, and we are only continuing to grow. I'd like to thank my incredible staff and the hundreds of people who left their lives and their jobs to join and build this campaign. I know what a risk that was. Very few people joined this campaign because they thought it was going to be a good career move. So thank you. Thank you to my team. My goal when I first started running was to solve the problems that got Donald Trump elected. In order to do that, I will support whoever is the Democratic nominee. That said, I hope this campaign can be a message and a word of caution and guidance to my Democratic colleagues that Donald Trump is not the cause of all of our problems. He is a symptom of a disease that has been building up in our communities for years. We must cure the disease that got him elected. And in order to do that, we must address the real problems that affect our people and offer solutions to actually solve them. I stand before you tonight and say that while we did not win this election, we are just getting started. This is the beginning. This movement is the future of American politics. This movement is the future of the Democratic Party. This wave is just beginning and will continue to build and grow until we rewrite the rules of this economy to work for us, the people of this country. Thank you to each and every person who made this campaign possible. I love and appreciate each and every one of you.
Love you,
Andrew. Being your candidate has been the privilege of my life. Together, we will continue to do the work and move this country forward because the Yang Gang isn't going anywhere. We'll be back soon. In the meantime, though, thank you all. God bless you, and God bless the United States of America. Thank you for everything. Thank you so much. Thank you.
Okay, do we need to do a sound check? We're all okay? All right.
Thank you so very much to each of you for being here today. My name is Dr. Nick Efantides, and I serve as the Chief Medical Officer of San Diego County. As the stewards of our region's health, we brought you here together today because we know there is mounting and significant interest in the novel coronavirus, which as of today, per the World Health Organization, has a new name. It is COVID-19. CO for corona, VI for virus, D for disease, /19. We are also aware that there is great interest in the respective roles within our collaborative efforts in our region with our federal and our local healthcare partners. In a moment, I am going to invite Dr. Eric McDonald, who is the medical director for the county's epidemiology and immunology branch, to make some introductory comments. And after those comments, I am joined by 3 medical colleagues that will collectively answer questions for you all. Dr. Christopher Braden, who is the Deputy Director of the National Center for Emerging and Zoonotic Infections and Diseases. Dr. Randy Taplitz, who is the Infectious Disease Specialist and the Associate Hospital Epidemiologist from UCSD Health, and our own Dr. Wilma Wooten, the Public Health Officer of the County of San Diego. Our hope and expectation in coming together today is to assure the public that they have the most up-to-date and fact-driven information available. And with that, Dr. McDonald, the microphone is yours.
Good afternoon. I'm Dr. Eric McDonald, E-R-I-C, M-C, Big D, O-N-A-L-D, and I'm the medical director for the county's Epidemiology and Immunization Services branch. I have served as the county's liaison to the leadership team that's conducting the federal quarantine at Marine Corps Air Station Miramar. I would like to state at the outset that we have enjoyed outstanding professional relations with all of those involved in this federal quarantine operation, led by the U.S. Department of Health and Human Services, the HHS, and CDC, with the support of the Marine Base and the U.S. Marshal Service. I'm going to concentrate on the specific county role, and to be clear, the county's role is that of, and that of the San Diego healthcare community is one of support. We are assisting the federal quarantine in 2 areas. First, we assist with the transportation, medical evaluation, and treatment of people under investigation for COVID-19. We call those PUIs. This includes the packaging and shipping of specimens to the CDC lab in Atlanta for testing for this virus. Second, we provide medical care and supplies as needed when the capacity of the medical services in the federal quarantine area are exceeded. So to detail the PUI evaluations that we support, when we are contacted that a PUI, or person under investigation, needs to be isolated at the hospital, we arrange a routine transport for direct admission to the appropriate hospital using CDC recommended guidelines. The hospital providers evaluate and draw samples as indicated using the CDC's guidelines, and they're held in isolation there until CDC communicates the result to the county and our hospital partners. In the event of being informed of a negative result, the evacuee is returned to the base under quarantine by the U.S. Marshals and HHS personnel. We've only had 1 positive test communicated to us, and this patient was at Miramar at the time, so this person was transported back to the hospital using the same CDC guidelines, and that individual is still isolated there. All other results have been negative or are pending results. I can summarize that there have been 9 persons under investigation involved with the effort at Miramar. 1 of those is positive, 5 of them are negative, and 3 are currently pending. And I'm not going to answer questions about the specifics of those individuals. It is important to note that all of the evacuees have been in federal quarantine throughout the process, being on base, moving off base, being in the hospital, and then returning to base. No people off the base, besides a few, very few, selected medical professionals, have had contact with these evacuees. There is no exposure to the general public. After all, that's the purpose of quarantine. For medical evaluations not related to PUI status off base, there has only been 1 incident. This individual was transported and treated using CDC guidelines, and then later evaluated to be sure that they did not have the COVID-19. We know that that patient, in fact, has a negative result and does not have the virus. That individual was returned to the base and is currently in isolation there. So that's the end of my prepared comments, and I'll let others go ahead and open up for questions.
Thank you so much, Dr. McDonald. With that, we will be happy to entertain some questions. If when asking your questions, you could please identify yourselves. I will call on you and then direct the answer to one of our panelists. Yes, ma'am. Based on patient protection guidelines, there are no other details available. Yes, sir.
Yeah, Dave Summers, NBC7. Can you walk us through the process in which this woman who was tested positive was taken from the hospital back to Miramar, and then what happened overnight, and then back to the hospital? Can you walk us through that? Help us understand what contact was made while there, what contact was made while outside the hospital, and in the hospital.
Thank you very much. I will have Dr. Braden respond to that question.
Yes, so I'm Dr. Christopher Braden, C-H-R-I-S-T-O-P-H-E-R, B-R-A-D-E-N. I'm an infectious diseases physician. I work at the CDC. I've been there for over 26 years. So to answer the question about the sequence of events, thank you for asking because it has caused a bit of confusion, and I'd like to put out the sequence of events so that people can understand what really happened. So this is a woman that was on the first flight that came to Miramar Marine Corps Air Station and was well on that flight. Actually, when we screened all passengers when they were deboarded that flight, she screened negative. She didn't have any fever. She didn't have any symptoms. She was assigned a room, and that night she had the onset of some scratchy and then cough. Every day for every person, we check them for symptoms and fever twice a day. That next morning, when she awoke and she realized that she had this cough, she reported that to us during the symptom check, and she was then transferred to UCSD Medical Hospital for evaluation. During that whole time, during the transfer, during that evaluation, she was under appropriate isolation. So at the hospital, samples were taken, and they go to the hospital laboratory, then they go to the county health laboratory, then they're sent to CDC. So for a number of reasons that we can go into if you want to, but the labels on the specimens actually did not meet some of the requirements for accessioning at CDC into the laboratory. And so they actually didn't go into the testing laboratory at CDC. when we were asking about results, and this is one of the lessons learned about, from us as a field team and also at CDC, we were under, a lot of pressure to get results back, and we were asking for results to be reported back verbally. What we heard was that all the test specimens that were accessioned went to the testing laboratory, and the results back were negative. And we said, that's great. All the tests are negative, let's take them out of the hospital. They were discharged, we put them in the van. When we get close to the base, we get a text message that says, important message. 3 of those specimens actually didn't go to the testing laboratory. They were never accessioned successfully, and they weren't tested. Okay, so here we are. We're now going back onto the base, and we have this new information, and we decide, okay, we're going to put these people in their rooms, in isolation in their rooms, instructed not to leave, not to mingle with the general population there at Miramar Base, and we're going to wait for the results of those tests. Well, of course, as luck would have it, it was one of those tests that came back positive. Let me emphasize, there was no fault of the test itself. The test itself was accurate. The issue was that the test wasn't run when we thought it had been. So let me put that kind of misinformation to bed, that the test itself was accurate. So once we get the result back that the test is positive, why then, of course, go through the same process, transport back to UCSD hospitals and back into isolation, and that's where we are today.
Just for clarification, how many people did that woman who tested positive come in contact with in this back and forth? And can you tell us who are those people, or any of them in quarantine?
Right. So we have done a contact investigation, as we would around any positive case. And, we're comfortable that she wasn't symptomatic on the flight over, and she wasn't symptomatic when she was going through all the screening and so forth. So all of those people are not considered contacts, and we're very grateful for that. There was an instance on the way back from the hospital when we thought all the tests were negative and we were transporting. There was actually 4 people that were transferred together, including her. So we have gone through the assessment of what kind of contact does that really constitute. So we would put that into, at most, the middle risk category and probably low risk category. Of all the passengers were wearing masks. It was a short duration, and they then went to their individual rooms for isolation. For those particular people who are evacuees, we would likely monitor their health for those additional few days. It doesn't affect the other evacuees that are here at Miramar as far as their quarantine period is concerned.
That was my, sorry.
Yes.
That was my next question. I'm Hunter Sowers with KUSI.
Mhm.
Does this change the amount of time that people are being quarantined if they were in contact with the person that confirmed to have the case? And then also, how, I guess, those masks, is that really, I guess, are they as protective as we think they are?
Yeah, so if you really were around somebody with a positive for coronavirus, you would wear more advanced personal protective equipment than those types of masks. That's why we consider those contacts either that middle range or low range in exposure risk. But again, this is somebody who's actually otherwise well, has a fairly minor cough. We don't consider her very infectious, and there is some protection with masks. We think that, and it's a fairly short period of time, so that was our assessment. Yes, so let me also, this is causing some confusion also, especially whether or not the test is accurate. Again, the test remains accurate. We have confidence in the test. What happened is that in this particular case, this this child screened with some concerning symptoms when they first came off the plane. And they were then transferred to Rady Hospital and tested negative. Then they go back to the Miramar evacuee population, and since then, the child has then developed additional symptoms that we want to evaluate. So we've then moved the patient back to Rady for that additional evaluation. So this is the sole caretaker of this child. So the father does go with the child. Yeah, it was basically an issue with the labeling, and it's no fault of University of San Diego Health Systems. They have their procedures. We have our procedures. They didn't match up exactly. We had some information that wasn't on the label that we knew where they were coming from. But when they go into a laboratory that's separate from the testing laboratory, we have specimens coming to CDC from go into our laboratory information management system. They're accessioned and then parceled out to the different laboratories around CDC. So they require a type of identification. You can call it two-factor authentication, basically, to make sure that the sample aligns with a person. Not all that information was there, so it basically hit a roadblock right there, and they weren't then transferred to the testing laboratory. Well, I don't want to, University of San Diego and I'm sorry, University of California, San Diego, they have their own protocols that work for them, but there was a mismatch when it came to the CDC. Well, we didn't realize that it was a mismatch until this happened, and since then we've made some changes. Do we want to?
Yeah, I just want to make a comment that, in general, what Randy Taplitz, R-A-N-D-Y.
And we will use our taxpayer dollars instead to reinvest in the needs of our people, in our communities right here at home. We will stand together and we will unite this country at a terribly divided time. Standing upon this common ground, motivated by this common love for our country and this commitment to ensure that we bring into reality the vision that our founders had for our nation, that we will have a government of, by, and for the people. So you've heard me talk about this many times, a government of, by, and for the people. But what does this actually mean? What does this mean in practice? What this means is that we no longer accept politicians who tell us there's not enough money to make sure every single person in New Hampshire, every single person in this country has clean water to drink. We will no longer accept politicians who tell us we don't have enough money for your child to get a good education. We will no longer accept politicians who tell us there's just not enough money to serve the needs of you and your loved ones and your families. There's not enough money to prevent Americans from going bankrupt, to take care of their sick loved ones. Because we are taking a stand to say we're going to stop wasting $4 billion a month in Afghanistan and instead bring those dollars right here at home. A government of the people, by the people, and for the people. That means leaders in Washington who are hearing your voices, who share your pain, and who share this deep commitment that we all have to strive towards that more perfect union, to stand united so that together we can usher in that bright future for every single American. That's up to us. That's up to us. So as we head towards this election, as we continue in the primary election, I hear from a lot of Democrats every day, you know, the number one concern that they have is we need a candidate who can beat Trump. Have you heard this? Do you feel this? Well, I am that candidate who will not only be able to beat Trump, but most importantly, I am that candidate committed to putting country first, to putting service above self, to lead our country in a way that allows us to heal these divides and to come together as Americans, putting our destiny in our hands and fighting for the future we know is possible. I just want to take a second and introduce you to Olivia. I've gotten to know her. I've gotten to know Olivia over the last several weeks. Her mom, Brandy, has been one of our incredible volunteer leaders. She not only brought Olivia, she has one of her other daughters here tonight, but Olivia brought her friends from school to go and stand at the polling place in Hollis and to encourage everyone to vote for Tulsi. And Olivia, can you tell everyone here tonight how you feel? How was your day today?
I had a fun time, and I was really happy that Tulsi could come over to Hollis. She actually came over and shook hands with people, and it really made a difference.
You guys made a difference. You guys made a difference. And what did you tell me the other day that you want to do? What do you want to study, and what do you want to do when you're a little older?
I want to be a teacher.
And why is that?
Well, I want to be a kindergarten teacher to help kindergartners have an awesome first year.
Thank you. Thank you, Olivia. Thank you so much. You're so awesome. Thank you. So when we think about why we're doing what we're doing, right? There are so many reasons why. And Olivia, you are one of those many reasons why. So that as you grow up, you will be able to pay it forward and help take care of others and make sure that, as you said, kids have an awesome first year, right? This election we have so much at stake. We have so much at stake. So yes, this is about beating Donald Trump. It's about we, the people, standing up and ushering in a bright future for Olivia, for her 3 sisters, and for all Americans. I am the first female combat veteran ever to run for president. I have served in the Army National Guard for almost 17 years. Like so many of the veterans who are in this hall tonight, I've deployed twice to the Middle East and experienced that reality of knowing that death could come at any moment. I got nothing to fear from Donald Trump. I will bring a fresh new generation of leadership with experience and understanding to turn that vision, those fresh perspectives and creative ideas into real solutions that serve you, that serve your loved ones, that serves our country first and foremost. Our democracy belongs to us. Don't ever forget that. No matter what the noise is on television, no matter what the pundits tell you, no matter what people tell you you cannot do, or what we cannot do as Americans, remind them and never forget that we, the people, determine our future. You make the decisions about who you want to lead this country and what kind of government you want for yourselves and your families and this great country. We know that when we stand united, we as Americans, we can accomplish anything. Anything. So, my main message to you here tonight is really one of thanks. Thanks. Our campaign is truly a beautiful, inspiring, people-powered campaign. That's all of you. That's all of you. People who woke up and said, you know what? I'm sick and tired of the same old, and I'm going to do something about it. That's what's happening here. A people-powered campaign. You have so much to be proud of. I have so much that I'm grateful to you for. But while I hope you have a good night's sleep tonight, we're back to work tomorrow, okay? I'm not joking. I'm not joking. We're going to South Carolina. I'm jumping on a plane right after this. We're going to South Carolina, and we will continue to spread this message to all Americans, to the voters of South Carolina, to the voters of North Carolina, to Georgia, to Virginia, to Massachusetts, to Vermont, to Maine. We are taking this campaign forward. Thank you. Thank you. Be proud of all that we have done together. Be proud of what more we will do together tomorrow. This is about our country. It is about our future, and it's about we, the people, standing united for each other to usher in that bright new future for everyone. Thank you all so much for being here. Thank you. Thank you so much. I love you all. I really do. I will miss seeing all of you every day, as we have throughout this campaign and the time that we've spent here. Know that you are in my heart wherever we go. And if you live in New Hampshire, I expect you to still be able to make phone calls and get online and get on social media. Come and help us out in Maine and Vermont and Massachusetts. Help us continue to spread this important message. Help us continue to bring about this change we need to see. Thank you all so much. Aloha. Thank you, thank you, thank you. Thank you. Well done.
You took the time to call me. Thank you. I'm a machinist. I made that. So.
This is so special.
Fair enough, lady.
Thank you
Thank
very
you for your
much.
service.
Thank you. Thank you so much.